This is Dr. Benzinger on Health with secondopinion.org. Depression treatment in pregnancy generally considered safe. Treating women with depression with serotonin reuptake inhibitors does not seem to increase the overall risk of birth defects, in a report that was concluded from the New England Journal of Medicine based on findings from 2 studies of mothers who had given birth after taking the newer classed antidepressant drugs. While the study did not find an overall increase in neural defects and most other birth defects, there may be a link between SSRIs and specific types of birth defects. One study found that maternal use of antidepressants for depression more than doubled the risk of certain types of defects that involve brain malformation. The other studies found that Zoloft and Paxil were associated with a higher risk of heart defects. There were other studies that showed even other problems with infant navel development and protrusions. However, the report went on to conclude that while statistically significant, these specific birth defects are rare and thus absolute risk with use of these drugs to treat depression is small. The source, the New England Journal of Medicine, June 2007. Postpartum Depression for Dummies documents fully why depression can have long-term effects on the mother, the father, the child, and the family unit as a whole, and why managing depression is a must. Recognizing and appropriately treating this disease is no different than any other. Recognizing it early is the most useful for conservative approaches in these situations. We know that medication is aggressive and is not considered conservative, so try conservative approaches found in Postpartum Depression for Dummies or Anxiety and Depression for Dummies first with your doctor's help. Realize that conservative approaches first is by far the first thing that you should consider. And even in this research document, if you notice, there wasn't not many people in this study. And to take that chance with your child is not called for in mild to moderate cases when there's counseling and other conservative approaches that can be taken, and I've referenced some of those books that can lead you in that area. We hope this helps. We'll look for you next time. This is Dr. Benzinger on Health with secondopinion.org. May God bless you.